Good morning, viewer. Welcome to our Glory Globe TV. Here's the breaking news. Yes, heart failure leads to 1.8 million hospitalization in India every year, according to a report by the Asian Pacific Society of Cardiology, which has called for action to control the condition. The APSC represents 22 cardiology societies in the Asia Pacific region, and its report, Heart Failure Unseen, Unmasking the Gaps and Escalating Crisis in Asia Pacific, was presented at the body's 27th Congress held in Singapore from 13 to 15 July. Heart failure is a serious life-threatening cardiovascular condition in which the heart is unable to pump adequate blood to meet the needs of the body. The disease affects around 64 million people around the world, the report says, adding that HF patients in the Asia Pacific spend between 5 to and 12.5 days in a hospital. As many as 15% of those hospitalized with the disease end up getting readmitted within 30 days of discharge, it says. A registry by the Indian College of Cardiology suggests that heart failure is the commonest cardiac cause for hospitalization, with 1% of the general population being affected annually. Some estimates from states such as Kerala said Jayagopal PB, an interventional cardiologist from the state, show that nearly 1.5% of the Indian population may have struggling with the condition, or approximately 14 to 20 million patients. The Indian College of Cardiology registry also says that patients with heart failure in India are younger, sicker, and have a much higher morbidity and mortality. While the average life expectancy has increased over the past decade, it has not kept pace with the progress made in several developed countries, according to the APSC report. We need to have a similar urgency and approach to heart failure as we have seen the cancer, said Dr. Alexander Mebazai, professor of anesthesiology and critical care medicine at the Hospital of Lariboisière, Paris, France, and primary investigator of a trial titled Strong HF, which has been dwelt on in the APSC report. The trial was conducted in the US this year to compare a high intensity intervention involving up titration, that is called gradual increase of medicine doses of HF treatments, versus usual care among participants with hospital admission for acute HF. There are irreversibly implications to poorly managed heart failure, and as seen with the Strong HF trial, with rapid simultaneous up titration of therapies and close follow-up, this can lead to marked improvement in patient quality of life, Mebazai said. Behind this report, Glory Globe TV, Delhi, India.